everyone, today I'm going to go over sensation testing as promised. To do this, I'll be referencing my Score Builder flashcards that I used when I was studying for the physical therapy licensing exam. It's important to note that there is a correct order to perform sensation testing. You want to first test superficial sensations and deep sensations. Additionally, you want to remove visual stimulus by asking the patient to close his or her eyes or even by blindfolding the patient with their consent. After testing superficial and deep sensations, you can go ahead and test cortical, also called combined sensations. So the superficial sensations are temperature, light touch, and pain. My Score Builders card says to test temperature using warm and cold test tubes. I don't know about you, but I've never seen a test tube in any of the clinics I've worked in. So you can get a little creative here, but try to use materials that are the same, but different temperatures for the testing. So maybe like a towel dipped in warm and cold water. Just make sure, obviously, that it's not too hot, so hot that you're going to burn the patient. And then for light touch, that can be applied using light pressure with a therapist's hands or with a cotton ball. Pretty straightforward. And then pain can be assessed by applying firm pressure with a pen cap, paper clip, or pin. So next up are the deep sensations, which are proprioception, kinesthesia, vibration, and deep pain. Proprioception can be tested by having the patient identify the static position of a body part. So before you begin this test, you're going to identify to the patient the positions. So let's say we're testing the ankle. We're going to place the ankle into dorsiflexion and identify that to the patient as up. And then do the same with plantar flexion and identify that as down. Similarly with kinesthesia, that can be tested by moving the body part in a direction and having the patient identify. So let's say you are straightening the elbow from a bent position and you identify that to the patient as straightening, and then you bend the elbow from the extended position and you identify that to the patient as bending. It's important to kind of scramble in between so that the positions are less predictable for the patient. Alright, and then vibration sensation can be tested using a tuning fork, and deep pain can be assessed by squeezing the forearm or calf. Cortical or combined sensations are kind of what they sound like. These are bilateral simultaneous stimulation, stereognosis, two-point discrimination, barognosis, localization of touch, and graphesthesia. So testing bilateral simultaneous stimulation is just like it sounds. You're going to pick an area of the patient to touch on both sides at the same time. Stereognosis requires the patient to identify an object using their sense of touch without sight. Two-point discrimination is tested using a two-point caliper on the skin, and then the patient identifies whether 1 or 2 points are touching without visual feedback. Barognosis is tested using objects of different mass. The patient needs to identify which is heavier and which is lighter. Localization of touch is a patient's ability to identify the exact location of light touch on the body. They can either give a verbal response or they can point. And finally, graphesthesia is the ability to identify a number or letter that is drawn on the skin without visual input. As usual, I've included a summary slide, a chart here for easy studying. If you like what you see, please check out my other videos and like and subscribe to support my channel. Have a great day.